Welcome to Growing Younger podcast, where we guide you through your journey of reaching your fitness goals after 40. What is the top reason for a knee joint replacement surgery to fail? This is what we're going to talk about in today's episode. Hi guys, my name is Alex Blazewski. I'm a physiotherapist from Growing Younger Fitness, and I've been treating people with knee problems for over 22 years. Specifically, I've helped a number of people who had a knee replacement surgery, so I helped them recover, rehab themselves back to normal. So to discuss today's topic, I've actually dug through a little bit of research and statistics, and so my earlier suspicion has been confirmed. So the top reason for having a failed knee replacement surgery is suffering a post-op knee infection. So in today's podcast, I'm going to talk about the risks. What are the risks of picking up an infection after having a knee replacement? And also, what are the signs to look out for if you suspect you may be having a knee infection? What are the signs and symptoms you should be looking out for? And what to do about it. So about 30% of all cases where people who had a knee replacement have to undergo a repeat review surgery, they happen because of a knee joint infection after the operation. So unfortunately, a lot of the time, after a knee replacement, if the person ends up with infection, they usually go on antibiotics, and quite often they also end up having a washout, so where they surgically go in and sort of get rid of the infection. And unfortunately, a lot of the time they have to take the old prosthetic out and put a new one in. So basically, these people have to start their rehab pretty much from scratch. And it all sounds quite scary. However, the good news is that only about 1% of people who undergo knee replacement surgery actually end up with a knee infection. And for those people who do end up with a knee infection after a knee replacement, it usually comes to the surface in the first 3 months. So the first 3 months after the operation is the highest risk. After that, the risk gradually diminishes, and it plateaus at about 1 year. So after about 1 year, the risk of picking up infection at that stage is quite low. Now, I want to make something very clear, okay? So by no means I'm trying to scare you guys out of having a knee replacement surgery. In fact, as I said, I help a lot of people recover after a knee replacement surgery, and the vast majority do extremely well. So the majority of people after a knee replacement, after a few months of recovery, they're actually very happy that they had it done. They've got their life back. They're functioning a lot better. The pain is better. They can go back to doing the things that they love to do, such as playing golf, walking, playing with their grandkids, all that kind of stuff. It becomes reality again. So so just want to emphasize, it's only a very small percentage of people who unfortunately have bad luck, and for one reason or another, they end up having infection in that operated knee. So how do you know you have an infection in your knee? So to know for sure, you definitely need to be seeing a registered health professional, a doctor, okay? But to give you a kind of a rough guide or a bit of an indication, so these are the kind of 3 main symptoms that you can be looking out for. So number 1 is pain. But look, I need to explain this in a bit more detail, because you can expect a degree of pain after having a knee replacement. So some pain is normal. However, a normal pain would be kind of what we call mechanical pain. So it will hurt when you do an activity. So for example, if you're trying to bend your knee, if you're doing some of the exercises you were given after surgery, you're trying to bend your knee, you're trying to straighten your knee, and you're kind of pushing it to the limits, and it hurts. I would say that's quite normal. If you're putting stress on the leg, if you're trying to weight bear, especially over the first few weeks, I think you can expect a degree of pain. However, if the pain is constant, if it's there even if you're not doing anything, say if you're lying in bed or if you're sitting down and it hurts no matter what you do, that should make you a little bit suspicious. Again, it doesn't necessarily mean that you're having a knee infection, but it is one of the signs that kind of, you've got to put it all together into perspective, but it possibly could indicate there's a chance you might be having a joint infection. Now, another sort of little tip there as well is that if you've been making good recovery for a few weeks after surgery and all of a sudden your pain starts to increase for no apparent reason. So you've had a few good weeks, every week your pain keeps getting better and better and better, and then all of a sudden your pain starts to spike and it fails to settle within a day or two. And again, if the pain is constant, then I would be more suspicious. I think that kind of presentation at the very least warrants you talking to your doctor just to double check. Okay, now the second sign you need to be looking out for is wound issues. So basically where your surgical incision was, in that sort of around that wound site, if you see any sort of ongoing oozing or any sort of pus, blood or liquid coming out of it, particularly after the first 7 days. So the first couple of days, you can expect some discharge from the area. That would be quite normal. However, in most cases, the wound will heal or it will seal usually within the first week. So if after 7 days, you still keep seeing ongoing discharge from the area, if there's any kind of pus coming out, and especially if it's also associated with sort of high levels of pain, that should probably make you suspicious that something is going on and you need to be checking with a health professional. And sign number 3 is ongoing or increasing inflammation. So how do you know you have inflammation? So there's a few sort of obvious signs that you can see or you can feel. So number 1 is swelling, particularly if it suddenly increases. So usually you do, like most of the time, you have some degree of swelling after surgery, and it will gradually, little by little, it will improve. However, if all of a sudden your swelling starts to increase again, that would, in my mind, indicates that something is going on. Again, it doesn't mean that you definitely have an infection, but worth checking out. Okay. Another sign of infection is if you touch the area, particularly around the wound site, and if it feels very hot all of a sudden, if it feels very warm compared to your other leg, then again, that sort of puts you at a higher risk that you might be getting an infection. And redness. Again, so if you look at your skin around the incision site, around where the surgical scar is, and if you see sort of unusual redness on the skin, again, this is a sign of infection. And also, if you suddenly start to lose mobility in that knee, so if suddenly your ability to bend the knee or straighten the knee starts to deteriorate, so if it starts to go backwards, again, so if more than one of these signs and symptoms is present, then again, that makes you more suspicious that something may be going on. Now, one other thing that I wanted to mention, so a lot of people believe that if you're having a joint infection, that you normally also have a general fever in your body. So not always, only about 40 to 50% of the time, if you have a joint infection, will you actually have general fever. So just because you don't have fever doesn't mean you don't have a joint infection. So that's very important to understand. So you have to look out for these other signs and symptoms that I just mentioned. Now, I'll quickly mention what are the actual risk factors. So what puts you at risk of having a knee infection after a knee replacement? So there's a few factors. So number 1 is diabetes, especially diabetes that is poorly controlled. If your blood sugar levels are quite high, that generally speaking, diabetes affects your general healing levels or healing rate. And it will also put you at a higher risk of getting infection after surgery. Now, if you're significantly overweight, particularly if you're obese, that puts you at a significantly higher risk of developing infection. If you have rheumatoid arthritis and you are taking immunosuppressive medication or therapy, also if you smoke, among other things, it's also bad for your joints, so it puts you at higher risk of developing infection after surgery. If you had a previous surgery before having a knee replacement, also it puts you at a higher risk. And if you have a kidney disease, if you have chronic kidney disease, unfortunately you run a higher risk of infection as well. Now, my final thoughts, okay? I know this all sounds scary, and we talk about infection and, unfortunately some of these, less fortunate people, they have to deal with having to have another surgery. However, keep in mind that only 1% of people actually end up with infection after a knee replacement. So the vast majority of people do really well. So statistically, there's a very low risk of actually getting a knee infection, okay? So definitely not trying to talk you out of having a knee replacement, but just for general information, I think it's good for you to know these things. Hopefully you picked up a few important things for you, and I will speak to you on the next podcast.